actually I wasn't having any real problems before I saw Nigel, but I was about to have, because my teeth were getting a little bit more dicey. Is that the right word? I don't know. But anyway, they were, and I had a horror of facing the future with teeth that had to come out. I know people put them in a glass at night or something. Having to eat with sticky stuff, sticking your teeth in so that they didn't wobble. Tasting. I think a lot of people have said that they don't taste their food quite so well. So when I was offered the chance of not having to have a denture and have implants, I was delighted. It was like a ray of hope coming through, because it had been a kind of a nightmare scenario. I think my dentist already knew of my horror of looking forward to dentures in my future. It wasn't old age or anything that I dreaded because of, some people say it makes them feel old. It wasn't. It was just the thought of having to deal with them. And so he recommended Nigel. He said, I'll phone him, I'll send photographs, I'll send x-rays. And the marvellous thing really was that I could see Nigel, and he would then send me a treatment plan with various options. And at this point, I wasn't committed to anything. I could then choose which option suited me, my bank balance, and I had time to think about it before making it, because the decision was quite a big one for me to make. This is another of the good things about this treatment, is that you can continue with your National Health Service treatment. I know that in some fields of medicine, once you decide to go private, they say, well, that's it. You can't continue with the National Health Service. But in fact, you can move between the two with great ease. Occasionally, when you're a little bit older than everyone else, you're made to feel old, but they didn't, which is always a huge plus as far as I'm concerned. Nigel himself explained the treatment in detail. Was very reassuring about any of the worrying aspects, such as pain and follow-on treatment if there were any problems. I don't remember much about it, because you have this marvellous sedation, so you don't know much that's going on. You just wake up with no pain or anything, because the medication is so good. Yes, the timing was good, because having a 5 o'clock one meant that one could go straight home and go to bed, basically, because I was still a bit woozy. So the 5 were done at once, and then I had to wear a temporary denture. Actually, I believe the next day, or certainly within 2 days, I was playing golf again. And that says it all, really. It meant that I could smile and swear and play golf within 2 days of 5 implants, which is marvellous, really. You don't have to take anything out, and when you go to bed at night, you just get your toothbrush out and clean your teeth. That is, in itself, is marvellous. One feels more whole somehow. Yes, you can taste your food more. Nothing slips when you're eating. You can laugh and have a lot of fun and smile without worrying that something might be going wrong that you don't know about, but that the person in front of you can see. You can kiss with confidence, because nothing funny is happening in there. In fact, it does actually feel like your own teeth. And that, for me, is all important.